Good morning, good afternoon, and good evening, everyone. Welcome to the FIP webinar, Pharmacy in Action, Advancing Health Literacy and Equity Worldwide. This is fourth event as part of the FIP advocacy series, and the specific theme for this event is driving equity through collaboration and advocacy. We will be focusing on Eastern Mediterranean region. My name is Aysu Selçuk and I am FIP Development Goals Lead. Before we start our webinar, I would like to share some announcements. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website www.events.fip.org. You may ask questions using the question box provided. You are welcome to provide feedback to webinars@fip.org. And if you would like to become a member of FIP, you can visit our website at www.fip.org/membership registration. We also have a translation tool in the Zoom. So if you would like to use this tool and listen this webinar with your language, please turn on captions and enable the translation toggle. Choose your preferred language under my caption language, and now you can follow along with the live translated captions. We would like to thank Haleon for supporting this online event. And as I mentioned, this will be the fourth series under the FIP advocacy campaign for health literacy and equity worldwide. Today's learning objectives are identify legislative and systematic barriers limiting pharmacists' roles, explore strategies for collaboration between pharmacists, policymakers, and communities, equip pharmacists with advocacy tools to expand roles in essential services. And here is today's program. We'll start with welcome and introductions and continue with the global and regional overview through recent FIP survey. And we have an interactive activity. Please join our interactive activity and share your comments, thoughts on the specific questions. And then we will continue with call to actions specific to Eastern Mediterranean region. And we have a Q&A session. Please feel free to ask your questions to our speakers today through Q&A box. And then we will be closing the event with your insights through interactive activity. And I would like to share that FIP development goals are essential in all FIP programs and links the program delivery to the FIP vision and mission via regional and national needs, underpinning all the FIP work to 2030. Development Goal 10, Equity and Equality, which is in line with today's webinar topic, health literacy, is composed of three elements. The first element, workforce and education, and it sets out clear strategies for addressing equity and diversity inequalities in pharmaceutical workforce development, continued education and training, and career progression opportunities. The practice element clears strategies for equity and diversity in pharmaceutical service delivery, service access, and service impact so that all people have access to quality pharmaceutical care. And the last element is science, and it is equity in global capacity of pharmaceutical sciences, training, research, infrastructure, development, and manufacturing capabilities, and evidence-based regulatory oversight. So before we move to today's webinar, I would like to introduce our speakers. Ahmad Taqi, he is assistant professor at the Kuwait University and also president at Kuwait Pharmaceutical Association, and also Zeid Kilani, he is CEO at Rawhi Group Pharmacies and president of the Jordan Pharmacists Association. So the floor is yours. Thank you.
Good afternoon, or good morning, or good evening. Thank you, Aysu, for the introduction. And as Aysu told you, my name is Ahmad Taqi, and I'm the president of the Kuwait Pharmaceutical Association. And I'm also an assistant professor at Kuwait University. And my background is in infectious disease pharmacists. Before I proceed, I may allow Dr. Zeid to also give you a welcome.
Ahmad. My name is Zeid Kilani. I'm the president of Jordan Pharmacists Association. I'm a true believer of pharmacist roles as primary healthcare providers, and that the role of the pharmacist should change from just dispensing medicine to enhancing healthcare in general. In the Jordan Pharmacists Association, we're working closely to change and regulate the role of pharmacists and overcome all the barriers. Hopefully, within this interactive session today, we can interact together on how to drive equity through the collaboration and advocacy in the region.
Yes. So before we start, I think during your registration, you were asked these questions, and we'll take the next few minutes to maybe discuss and go through some of the answers, just to give us a good baseline as we go and proceed with the discussion. So one of the interesting answers was that how the question was, how can collaboration and advocacy effort drive greater health equity in the Eastern Mediterranean region? And the answer was exchange of best practice in primary healthcare delivery. And this is actually a very good point, because pharmacists in the primary care are becoming more and more involved with the community, and it's an area where we can directly communicate with the public, and it's a good opportunity to raise equity and literacy in healthcare as well. Another answer was collaboration and advocacy can greatly advance health equity in the region by uniting partners. And that's also a very important aspect, because all of us would be interested to improve health equity. All of us would be interested in helping with health literacy, but to do it together will also have a synergistic effect, let's say, as pharmacists, to achieve that goal together. Similarly, by doing that, we can establish a training program that would allow pharmacists to be more competent and more willing and engaged to do that. Another point that is very interesting, and I think that's where this event actually comes in line, is by sharing resources and expertise. Richer and more stable countries can support those in crisis or those in need. And not only richer countries, but countries with improved or established a program that support health equity within the FIB or even with the region to support other countries that are in need of this experience. So I think that's why these events and these programs that is developed by FIB aims to bring everyone together to share the experience and expand the role of pharmacists, especially when it comes to health equity. And then one of the things that also discussed was raising the awareness of stakeholders, and we want every stakeholders to be involved in this process. And you might think it's common sense and it's very easy to think about, okay, health equity, and we want to achieve that, but stakeholders sometimes are overwhelmed with a lot of responsibilities and a lot of urgencies. So sometimes this topic can slide under the radar. That's why we think collaboration and advocacy efforts, especially from pharmaceutical associations and societies, can always bring this topic up to the surface and make it a reality, really. And finally, I think collaboration and advocacy are essential to achieve health equity, which means addressing social determinants of health, which actually sums the whole discussion. So I think after taking your responses, this is a good introduction to maybe proceed with the next part of this talk. And I think can you move to the next slide, please?
Yeah, Ahmed, and actually, if you don't mind me also going back, the answers were so aligned with the presentation we're going to go through today. This is so nice to start. Now, we're looking at this slide about the global overview of the survey findings that we did, which reflects responses from 149 pharmacists across different regions of the world. Regarding participation of the pharmacists in public health activities, 72% of the pharmacists reported being involved within the past year. The most common areas of involvement were medication safety and adherence, infectious disease and vaccinations, and chronic disease management. If we look at who led these activities, most campaigns were self-initiated or community-led, followed by those organized through national pharmacy associations and employers or workplaces. This shows that pharmacists are taking initiatives at the community level, often without formal structure driving these efforts. However, when it comes to the use of technology, only 28% of the pharmacists use digital tools regularly, while 45% use them occasionally and 27% not at all. This highlights an opportunity to strengthen digital integration in health promotion and service delivery. Now, looking at the barriers of the pharmacist's engagement in public health activities on the right side, if you look at the right side of the slide, the main challenge limiting pharmacists' engagement are both structural and motivational. The top three are lack of incentive or recognition, lack of time to participate in campaigns, and limited institutional or employer support. Other barriers include low public interest, insufficient training in health promotion, and limited awareness of available opportunities. Finally, our findings identified 5 key clusters of support and training needs: tools and resources, skills and knowledge development, recognition and accreditation, collaboration and network, and structure and system support. In summary, while pharmacists globally show a strong willingness to contribute to public health, their impact is often constrained by systemic and resource-related barriers. Strengthening institutional support, incentivizing participation, and expanding training opportunities could significantly enhance their public health engagement worldwide. This slide showed the summary that I just given. And now going forward, Ahmad, if you can take the other slide, we can discuss, and if you can put your notes regarding the slides so we can discuss later as well.
Yes, thanks, Zeid. From the same survey, we zoom into the area, the Eastern Mediterranean area, which there were small size, although 6 pharmacists, but yet still representative. Most of us can relate to the same issues that they discussed in this survey, which was basically an interview finding of the same objectives mentioned by Dr. Zeid earlier in the Middle East area. To give you more details about that, I think 6 pharmacists represents 4% of the total participants in the survey. The majority of the participants, about 38%, reported that they have participated in public health initiatives within the past year. Most of these were joint initiatives. And then the most common involvement, if you want to go to the topic and the areas they covered, I think the most common involvement was both equally in infectious diseases and vaccination initiatives, which is a big topic, especially post-COVID. You can relate to that pharmacists became more and more involved in that, but also in other healthcare and medicine access topics. And then when you go into it in more details and try to focus on what might be the barriers to achieve or to be more involved in health literacy, you can say it's really consistent with what Dr. Zeid mentioned earlier in the overall report. I think the most barrier towards supporting or being active in these initiatives is time. I think time is always an issue, is always a challenge. And it's about 30% of participants reported that lack of time to participate in this campaign was one of the main barrier. The second most, or the equally, another about 30% reported limited support by employers, by institutions, and that's why, if you remember in the beginning, we discussed that involving stakeholders is very important, because you need the management, you need the upper management support to be able to deliver these initiatives. Other barriers was, again, lack of incentives. Some of them, which is about 15%, reported they weren't aware of the opportunity. So they weren't aware that such initiatives are available for pharmacists to participate in. And the last one is insufficient time insufficient training in healthcare promotion. So that might be interested, but they don't feel they're competent to do these. And these findings highlight both the pharmacists' enthusiasm, but also to engage in public health. But also, as Dr. Zeid mentioned as well, that there's some limitations and barriers that might hold pharmacists from achieving this goal of being active community members. Maybe Dr. Zeid will take a deeper dig into the challenges and opportunities in the region when it comes to that.
Sure.
Can you next slide, please?
Okay. Now, from what Dr. Ahmad just presented, the interview finding several examples of pharmacist-led public health initiatives across the Eastern Mediterranean region stood out, which is actually very impressive. For example, in Egypt, pharmacists played a central role in the hepatitis C elimination campaign, contributing to reducing 7 million cases to zero. And that was recognized by WHO. And in the 100 million for your health campaign, pharmacists provided public education and screening for hypertension, diabetes, and cancer. While in Jordan, proudly, what we did, the Jordan Pharmacists Association Syndicate led national initiatives such as Ask the Pharmacist for Your Healthcare. That was in 2018. We did the SMART program on respiratory health. We did the flu and COVID-19 vaccination awareness campaign, with pharmacists later trained to deliver COVID vaccines. And that was a great initiative, helping increasing public awareness and COVID vaccinations for the public. And an ongoing smoking cessation campaign. And now we're planning to do a dedicated clinic for smoke cessation led by pharmacists. In Kuwait, pharmacists led the Varicella vaccination campaign targeting adults through malls, clinics, and media outreach, and an inhalation technique campaign that used pre and post surveys with education sessions to significantly improve inhaler use among the public. These are clear examples showing how pharmacists across the region are contributing meaningfully to disease prevention, health promotion, and public health awareness. On the next slide, if we can move to the next slide, please. With other interviews were done. The interview's findings also revealed key challenges and opportunities to strengthen pharmacists' role in advancing health literacy. Regarding the challenges, and that's very important, and that was mentioned before, outdated legislation continues to narrowly define pharmacists' roles, creating bureaucratic delays in expanding their scope of practice. Second, there's a lack of formal recognition for specialized pharmacist roles with professional licensing process that is still lagging in many countries. Third, limited government prioritization and the absence of a coordinated national framework for pharmacy-led public health initiatives hinder sustained progress. Finally, capacity gaps in designing and delivering evidence-based campaigns combined with a heavy reliance on volunteers often affect the overall quality of public health initiatives. Despite these challenges, there are significant opportunities to build on. Expanding vaccination services through community pharmacies to increase access, especially in underserved areas. Positioning pharmacists as public health educators in their daily practice, not just medicine dispensers, can strengthen their contribution to preventive care. Leveraging mass media and social media can help establish pharmacists as trusted source of health information and counter misinformation. And finally, Strengthening health literacy training and pharmacy education can make public health engagement both a recognized and rewarding part for professional development. In summary, the East Mediterranean region shows promising momentum towards integrating pharmacists more fully into public health systems, if we can collectively address the policy and capacity gaps that remain. Ahmad, if you can take the next slide.
Yes, good slides, Dr. Zeid. Very well. I think the next part will be the interactive session, and I believe you should have a barcode that you can scan using your devices, which will take you to the interactive session, which we have the first question is, what should be the priority action to improve health literacy in your region? So please take a few minutes to answer and interact with us.
Yeah, I would love to see your answers here so we can make it more interactive.
The more interactive you are, the better the session is, hopefully.
Yeah, I see someone is participating already. I believe actually education training for pharmacists is really important. I truly believe this is a key note that has been mentioned before. We still mention it, and I think, Ahmed, you see it in your scope of work and in the association as well, that it's really needed.
Yes, and it's an opportunity as well. So you can use these initiatives not only to help the community, but also to help pharmacists get it trained and be up to the task. So when they go back to the community, they can still continue doing what we hope they do.
But also through the challenge that it won, this education training should be recognized somehow, and the pharmacists should be recognized that they've done this training, and they should have a title or a certain certificate to ensure that the recognition is there. So it's a kind of an incentive as well.
Yes, true. And I think that's what the challenge comes when it comes to public health initiatives, is that as it's one of the main barriers discussed is incentives. So how can you incentivize these efforts to make pharmacists more engaged in it?
Yeah.
I think we also have another
collaboration with governments, institutions, and universities, pharmacy organizations. This is the pain most of the associations have, especially with the governments. Recognition, the pharmacists we still have this challenge of giving the pharmacists their true role as healthcare providers, as public healthcare providers. Is still the understanding should be done more probably, and we need to change legislation. I totally agree with this as well.
Yes, and that's the theme of this talk is collaboration and advocacy, and we might have some challenges with certain stakeholders, but also we need to have everyone involved. As we said, these initiatives, to be fruitful, they'd have to have a plan for the community, that all these stakeholders are involved in supporting either the government by recognizing pharmacists, incentivizing that, institutions and pharmacy organization by leading these projects, but also university by preparing the graduates and the students to be not only clinically oriented, but also community oriented and motivated to be part of this. Another one was developing leaflets and guidelines for pharmacists to address the issue. Again, this goes in line with education, I believe, in training, but maybe having these resources would help them massively to achieve that.
Sure. I would also go back for the information dissemination. I totally also agree with this. We as pharmacists need to step up also on the social media, on TVs, and take our role as healthcare providers, as people that give true advice. Because today, if you go wherever you go, the information is given from people. Sometimes they're not even healthcare providers. Someone that has been through a certain practice or certain experience, they go on social media and they just give information. So if the pharmacist takes this role, it's really would contribute to the pharmacist role in general in the public health. And totally agree with this as well.
Certainly.
What else?
There's mandatory health literacy. Okay, I think mandatory health literacy.
Yeah, we've covered this as well through the education, the universities.
I'm not sure what is meant by. Okay, so the next question is, how should pharmacists collaborate with other stakeholders to improve health literacy? So from a pharmacist perspective now.
Okay, that's interesting, because usually we wait for the stakeholders to do something. It's how should the pharmacist now collaborate? It's an interesting way to see it as well.
Yeah, that's a good one. So we have one participant who's organizing workshops, seminars in collaboration with stakeholders. So what essentially they're saying is you want to bring the stakeholders to the table to start these discussions and get them more involved. Yes, and that's a very important.
Yes, definitely. So you can
point.
explain to them what's going on, how things are working.
Yeah.
Yeah, because sometimes it's like you say, it's just people do not recognize the real role of a pharmacist. So if we do that, they might understand the expanded role or the bigger role that we need to do.
Yes. And then another response was about funding. So these pharmacists can collaborate with other health stakeholders to get funding for these campaigns and events, which should be led by pharmacists. So perhaps that's also a good point, because a lot of pharmaceutical companies sometimes they have the budget to support these initiatives, but they need a platform, and then we pharmacists can also provide this platform to make these events a reality, I think.
Open communication, conduct home medication reviews. Interesting. How would that act with other stakeholders? As that's interesting, actually, see it from a different point of view. Yes, home medication reviews, the patients are stakeholders. If you look at it from this point of view, I was looking at legislations when they said stakeholders, but when you look at it from this point of view, yes, that's another stakeholder. People are stakeholders. Patients are stakeholders. So that's very interesting. I like this one as well.
Yeah. Then pharmacists should collaborate with physicians, nurses, regulators to standardize and simplify all medication information using techniques such as the teach-back method to ensure each patient understands the treatment plan. So I think what they're trying to say here is you need to standardize the way of communication with the patient to simplify the language. So instead of hearing different things, meaning the same thing from different healthcare providers, we need to maybe unify and simplify the language and make it consistent so the information can be easily captured by patients and the population, which is a very, very good, very well put point, let's say, from the participant.
Yeah, that is a different approach. Yeah.
And I may add something for the discussion is that sometimes as pharmacists or maybe pharmacy organization, sometimes we need to sit with the stakeholders to establish what is needed actually. What's the priority for us in terms how do we target this health literacy? So should we target everyone? Should we target specific areas in healthcare? Should we target specific population? Because once we have a targeted approach, that would have hopefully better outcomes and more concentrated efforts.
But you can take it one step at a time, though. You can take the first target, the most important target, and then let's say who's your target audience, what's your main goal, and then move from there one by one to achieve what you want. Because if you open all the channels at once, most probably it's going to be more difficult. But eventually, we're going to get there.
Absolutely.
Of course, regulations as well. We 100% we need to change a lot of regulations and change the legislations to give the pharmacists a bigger role. Some countries have already advanced in this. Some countries are still behind. Yet we have to move forward, all of us, exchange experiences, and how to move forward with it. I think this is really important.
And
Also
then
encourage patient engagement. Yeah. Sorry, please go ahead.
Goes to the same to what you mentioned as patients, as still also as stakeholders in this, and they need to be involved.
Yeah.
Good points. Good participation. I think we have a third question for you. Nice, if you can move to the third one, yes.
Yeah.
So what strategies can pharmacists implement to make health information more inclusive and accessible?
We're the most available. That's what
We're
I keep
always
saying,
available.
at least in Jordan. In Jordan, we're available. Pharmacists are everywhere. Pharmacies are everywhere. So we're the easiest to reach when you talk about information, public health information. We're there. We're all around.
Yes, I think. And how's, if I may ask you, how's the public trust in pharmacists? Do they use them as a source of information?
But they used, if there was no study done, but I truly believe if they do a study, pharmacists in Jordan will be the #1 trusted information because of the availability. Because it's easy access, especially the pharmacists in the pharmacies, easy access. People go ask them everywhere. They go from the doctor back to the pharmacist. If they don't want to go to a doctor, they go to the pharmacist. It's much easier for them. Easy reach and easy access.
Yes. And then this access can be utilized to improve literacy and patient education when it comes to that. I think one of the answers here is, I mean, it goes in line to what you just said, is we need to advocate the role of pharmacy in health literacy, pharmacists, sorry, in health literacy.
Yeah.
So perhaps the Jordan model, we need to maybe expand it more in the region where we need to advocate for pharmacists as the first point of contact for the community if they have any health questions, simply because they are more available, they're more easily accessible. Most countries would have a pharmacy around the block, so that's significantly helped the matter.
Yeah, even to the second point, develop campaigns to reach rural areas. Again, some rural areas might not have many doctors. They might have one doctor, but they would definitely have at least few pharmacies around for easy access. So they all go together. The pharmacists, well, I'm sure the pharmacists everywhere, it's not just in Jordan, are available and have easy access.
True. And what do you think of the idea of using social media to do that as well?
I was about to say that. I was about to ask you the same thing. I believe also today, because we've mentioned before, but I really want to emphasize on this. If we use also trained pharmacists to go on social media and start talking about healthcare, that would help pharmacists everywhere, all around. I'm trying to do some specialization to actually train certain pharmacists on the media. They're pharmacists, they have, but how to go on the media and speak on the media and do a degree with some kind of diploma to become a specialized media, pharmacist, to replace all the trusted sources, the other not trusted sources, to be replaced with the pharmacies. I'm going to try this program very soon in Jordan and build it up.
Very good idea. And that's, I think, where us as associations also needs to come in, because social media can be tricky. You get a lot of information coming from all over the place, and maybe the public will find it challenging to identify who's authentic and who's not. So maybe that's where the organizations and associations, societies that can provide this kind of social media channels and platforms to deliver more trusted
information. Exactly. Yeah. Yeah. Again, it all goes without the health education is true, simple language. That's actually what we use, because we use with the language we use as pharmacists in the pharmacies and every other places is the common language, because we talk with a patient and empathy. The patient comes, he keeps on asking the medications. So to totally agree with all the points mentioned here.
And the main challenge is the main challenge is, as I see some comments about increasing educational events, it's true, but I mean, the main challenge is these community, these public, these patients, they might not very interested in the scientific language or in sitting in a lecture or listening to us talking pharmacists. So maybe we need to figure out or find a way to make it maybe as part of your dispensing routine, like you're dispensing this medication, and then you try to use that time to educate your patients, or through interactive social media, post videos, very short, straight to the point, which you deliver the message without overwhelming the patient or overwhelming the community.
Yeah.
Yeah. Good points. Very good
Even
points.
cultural competencies, we're part of the community, so we speak the language. So totally, we're 100% on spot to become the lead public healthcare providers with literacy, because that's what we do. What we need now is to be recognized and take action and step forward. I believe this is all going in the right direction.
True. And I think we can, at this point, conclude the slides. And I'll take this opportunity to remind you that this campaign is not only here today, but it goes beyond that and continue. You can follow the FIB social media platforms, which you can find more information about this call to action plan, which aims basically to connect with policymakers or associations to discuss reform needs, collaborate with other health professionals to shared on shared initiatives. We also aim to promote pharmacist role in vaccination and chronic diseases management. That's again goes to what Dr. Zeid was just talking about. And then you can join or start advocacy campaigns for equitable access. So FIB has a lot of resources, can help you to be an active member in the community. So utilize them, follow their social media accounts to keep up with that. The next slide.
And if you can also share your comments after the event, we'd really appreciate that. You can scan the barcode, add your comments here. Again, your comments are very important to enhance future lectures and everything we do. And this is an interactive lecture or presentation, let's say. It was very, very interesting for us as well. We learned a lot, and I'm taking a lot of notes. So your notes are very important to take with us for later as well. Now, we're still open for other questions.
Yes.
So if anyone has a question, we're also ready for those.
Yeah, please feel free to write your questions in the Q&A box. Thank you all for your comments for our questions. So while we are waiting questions from the audiences, maybe I will ask a question to you both. What do you think about new strategies can pharmacists offer to improve health literacy? So Dr. Zeid already shared some examples, but what else can be done in the Eastern Mediterranean region or in globally? Yes.
Honestly, I would go back for today. Would also emphasize on the social media, and the media is a huge role today. Changing legislation is also important. Pharmacists in the place. One most important thing is to become, all right, if I can rephrase it, today we wait for the patient to ask. A lot of the comments today mention something that we need to advance, we need to start the conversation. It doesn't always have to be, in my opinion, just about medications. Why don't we take it for another step forward? Why don't we talk about weight management? Why don't we talk about beauty? Pharmacists do that in their pharmacies. So if we start somewhere, people will become more aware of the role of pharmacists beyond just certain things. Chronic medications then steps in. Management medications. I believe we as pharmacists need to step forward and offer these services and offer ourselves to the public and not just wait for the public to come and ask us. That's part of the things I think we need to work on.
And I can add something to that as well. We can also work with younger generations. I think we can work with schools in the community to educate a young learner about medication safety and how to be aware of medications. So we don't have to wait for them to become old and sick and then try to educate them and teach them. We can start at a younger age, which makes our life easier in the future.
I love what you said, Dr. Ahmed. I tell you what we did in Jordan for the smoke cessation campaign. We started smoke cessation campaigns. We were doing the smoke cessation campaign, and now we have a campaign. I'm translating into English. It's called an era or a generation. Sorry, it's a generation, a smoke-free generation. And what we did, pharmacists are visiting schools, and the pharmacists are doing the literacy for schools, starting from young age, from I think 10 years old onwards, 10 years old onwards, and we're going through schools, and pharmacists are doing this. So this is a great thing, starting with children. And the funny part that children from now are saying, oh, we want to grow up and become pharmacists through what we're doing. So this is a great campaign that we're doing now.
Amazing.
Yeah.
Congratulations.
Thank you.
It sounds like a great initiative. So we have a question from the participant. What skills do pharmacists need to learn to form policies related to public health?
Number one needs to be communication skills, I gotta say. As much as a clinical information you have, and as much as clinically competent you are, you need to be able to transfer this information to the public. And it's different than what we learn in university, talking to healthcare professionals, or it's more about showing empathy and sympathy with the patients. And then you want to gain this trust, especially if you're the pharmacist that this patient comes to you every month to dispense their medication or every few weeks. It's important to have this relationship with that patient, so for trust and respect. That would make your life much easier to say. Yeah.
No, I totally agree. And beside the communication, for public health in general, there's certain subjects. There's the public health subject itself, and there's certain courses and diplomas for public health, and there is the specialized interest. Today, what I tell our pharmacists, what do you like? Certain pharmacists are interested in certain things, and they have a passion for certain things. Today, longevity, for example, I'm giving stuff like that. Today, longevity is taking everyone's mind. People want to stay younger. People want to look. It's not, pharmacists is not just about disease. It's about health, and health is being healthy. So that's public health. So we're always associated with medications, although today our role is we as pharmacists can help you not to use medications when you grow up. No, we want you healthy. So if we go to wellness, longevity, yet some other people, their passion is with pediatrics. They can go with kids and learn more about healthy public health. So it's the more specialty we have, the better we present ourselves. So you can take the courses there, and of course, all these need the communication that Dr. Ahmed just mentioned.
Do you have more questions?
I think we don't have any. So before we move to the closing remarks, I would like to inform our participants that the certificate for attendance of this digital event will be shared via email tomorrow. So you will receive the email addresses that you registered for the event. So I will going to share my screen for your concluding remarks.
Honestly, as closing today, we'd like to thank every participant. For me, Ahmed, this was really interesting. It was intriguing
Unique
concept. Yeah.
experience.
I loved it, to be honest. I'm so happy. So we'd love to see the remarks as well from everyone. It was very inspirational as well.
True, true. And again, thanks everyone for coming. I hope today's session will get you more interested in being part of such initiatives in your countries. And I gotta tell you, even if you're a student, a young pharmacist, being involved in these initiatives will not only help the community, but it will help you grow as a professional in your career. So take this opportunity if it present to you.
Yeah.
And then again, I will remind you to use what you have heard on Inspire Action today in your pharmacy community or even classroom if you're a student. Share these ideas with your network, start local initiatives, and advocate for policies that strengthen health literacy and equity. We can turn today's insight into lasting change, ensuring no one is left behind on the path to better health for all. Remember to, again, follow the social media accounts to get updated and up to date with what's latest and FIP media and content.
Today, we also, if you go on the future FIP digital events here, you can find all the events that FIP organizes. I truly encourage you to participate. There's a lot of FIP conferences, lectures. Again, according to your section, you can find something in the community pharmacy sections. You can find something in the academia. You can find in policymaking. There's a lot of events. And of course, the major event is in Montreal, the FIP regional conference that will happen next year, if I'm not mistaken, in Montreal. And that's really important. So I encourage everyone to go into the event and register. And next year is really looking enthusiastic. You can register from now. Book the dates at least. It's from 30 August to 2nd of September 2026. You have time to register, and trust me, book your dates early because you won't find a place. It's if you don't do it, it's going to be full. And the earlier bird you get, the better chance to attend. So there will be integrated sub-themes. There will be integrated health, pharmacy advancing well-being through a One Health approach. Sub-theme 2 will be innovating with purpose, driving change through science, education, and practice. And sub-theme 3 will be collaborating for equity, strengthening global impact through partnership and inclusion. Important dates that are coming: 18 March 2026, abstract submission deadline. You have to participate in these. That's interesting. 17 April 2026, review outcomes communicated. 3rd June 2026, early registration, fee deadline, and I can encourage everyone to go through that. Get a high discount. 12 August 2026, second registration deadline. So book your calendars, everyone. Montreal is coming next year, and it's really interesting. Thank you all for attending.
Yes, thank you so much. And
And
thank
we
you.
need to thank Aisu, come on.
Yeah,
Of course.
You've done a great job, Aisu. Thank you very much.
Dr. Zeid and Dr. Ahmed, for your contribution and useful insights in this topic. We look forward to seeing everyone in the FIP Congress in Montreal. Thank you all.
Thank you very much. Take
Thank
care.
you, Dr.
Bye-bye.
Zeid, as well.
Thank you, Dr. Ahmed. It was a pleasure. Take care. Bye-bye.